Live from the Business RadioX studio in Atlanta, it's time for Dental Business Radio, brought to you by Practice Quotient. Practice Quotient bridges the gap between the provider and payer communities. Now here's your host, Patrick O'Rourke.
Hi there, friends of the Dental Business Radio community. This is Patrick O'Rourke. I am your host, and I would like to thank our sponsor. Our sponsor is Practice Quotient, PPO analysis, negotiation, and strategic guidance. They represent top-tier dentists and top-tier dental specialists. If you feel like you are a top-tier established dental specialist and you are not getting reimbursed or paid on your fee schedule contracts appropriate to your time, competitive advantages, and expertise in your healthcare outcomes, then you should talk to the fine people at Practice Quotient. Their telephone number is 470-592-1680. That's 470-592-1680. Their website is Practice Quotient, QUOTIENT.com. Like intelligence quotient, but Practice Quotient. And so we'd like to thank our sponsors very much because they are able to bring us on the best guests. I would like to welcome back to the show Christine Taxin, the godmother of dental medical billing, from New York to Florida, and then she's in more places than I ever go, that's for sure. I don't know, she's got a bundle of energy. So welcome back to the show, Christine. How are you?
I'm really great, and thank you for having me again. I love being with John, really. I'll take you too, Patrick. Oh, John is the man, and you're the boy. You know, everybody, I just want everybody to hear that Patrick and I are very good friends, and I like to just have fun with him.
Right.
And we have a lot of
smack.
We have a lot of serious conversations. John could attest to that because before we got on, we just had a very serious conversation. And the reason why we have this togetherness is because we are both passionate about coverage in this country, not only medical, but dental coverage. And that is important to us because everybody has families and everybody has needs. And we have really tried to not only do our end, but we try to work together, I believe, a lot of us, to really help move that pendulum to the side of taking care of patients and not taking care of the insurance companies. I don't know if we're winning, but we'll keep trying.
Yeah. Based on the stock prices, I would say that we are losing. That being said, I think that we come at it from different angles as well. So me being from the insurance business, I don't vilify the insurance companies. I may make fun of them every now and then, but I feel like I have the credibility to do, and it's really, I'm just poking fun. I think that there are numerous stakeholders in the healthcare issue in this country, that there's not any one that is quote unquote the problem. Okay. Right. They're all problematic, and there's no saints anywhere, right? So from the PBMs to even the patients, in my opinion, everything is supposed to be free. They don't want to take care of themselves, et cetera. So as a taxpayer, if I don't want to have to pay for somebody who sits in front of a TV and plays video games and eats Doritos and it sucks down Mountain Dew all day long, that's me. That's my personal opinion. It's just one man's opinion. I also don't think that bureaucracy is the answer to really any complex problems, but particularly something that has to do with healthcare is local, healthcare is very personal, and this is what talking to you gets me going. So I usually want to do this. I just get my host routine, but because we were, let's say, discussing CMS and other mandates prior, now I'm all riled up. So that's what it gets, and I think it's good though, and I think you're hilarious when you get riled up and you ask people if they're crazy. That's probably my favorite line ever. But as we all get together, even there's multiple different viewpoints. I think that the collegial nature of having a discourse without getting upset at somebody else's perspective is critical to the conversation. And too often it gets muddied by politics, which is, and I don't, whether you're red or blue, you're both wrong on this issue, in my opinion. Right. In this, it's a very complex and layered onion that needs to be unpeeled. And who knows if we're ever actually going to unpeel it, which is where we had left off right before John Ray's. We needed to get to the show because otherwise I'll be here all day. Shout out to John Ray. He is with us. And just for everybody's reference and record, I do make fun of John Ray frequently on the show. And the reason for that is because he's the opposite of what I make him out to be, which is what makes it funny in my own twisted head. I make him out to be a wife beater wearing, Trans Am, T-tops driving, moonshine making hillbilly with no shoes on. And only part of that's true.
Only part. Okay. John, I love you no matter what. And hillbilly's making some moonshine. That's not so bad. We have a vice president now that was a hillbilly. Think about it. John could someday be the next president.
He could be. He's making.
But I want to get a little serious, just a little, not a lot, because I don't like being serious. But I also I have to say this so that the whole audience hears this from me. I only teach what is needed to help the doctors and the practices earn more income and have patients have more treatment coverage. So when I'm teaching medical or I'm teaching anything, I'm not making the rules. I'm just teaching them. And I keep telling the audiences one thing. Every doctor, every hygienist needs to have the voice on why they feel coverage is not adequate or needs more transparency or coverage for people with certain illnesses. Because in truth, why are we letting the government rule it? Why are not the providers doing a little bit more? Because my voice counts for about this much, and I have a loud voice. Know what I mean?
I do.
But when you have a whole organization,
I can always find you in a crowd of people, even though you're like 3 foot tall.
That's right. And I'm a true New Yorker, but it doesn't help being a true New Yorker when you're dealing with a whole government bureaucracy. And so when I'm teaching, I'm giving information to help them help their patients. I don't ever tell somebody go in network. Never. That is a choice every individual doctor has to make. That's their choice. But I think that the knowledge of knowing what you can do with medical, because dental is changing a lot, in my humble opinion, from what I'm seeing, because of the mandate now on Medicare, many Medicare Advantage plans, veterans plans, federal worker plans, like all the Blue Crosses, they're all going to be asking you for ICD-10. It just is going to take about another year, in my humble opinion, and that this is just one person's opinion, like yours, that other insurances are going to want that information. There's only one reason why I like it, and I'm going to breathe that one like that I like. I feel like people that do sit home and do nothing and eat Cheetos all day and then get sick and they're on Medicaid or Medicare or any of the government policies that we help pay for, they should have the inability to keep coverage if they're sabotaging their own health. Because there are people that go to the doctor and are told you're diabetic and you need to do X, Y, and Z, and they don't listen. There's plenty of people that come to our offices and we tell them you have an active infection and they do nothing. So in the course of time, everybody else is paying, whether it's federal insurance or regular insurance, because how could they pay more if they're paying for the stuff that people really don't care? Does that make sense to anybody?
It does. It makes sense to me, and I concur. This is coming from I'm not an elite. I don't drive a Bentley. I drive a Kia. I like it, by the way. It's a nice Kia. And I grew up very humble. I don't say poor because I've been to other countries now. So we had indoor plumbing. So it was okay. And I think that anybody in this country has the ability, the upward mobility and opportunities. It may not be perfect, but it's there more so than in most places in the world. When I remember one time I got something in my eye and I was probably like 19 years old. I didn't have any medical coverage and nobody would see me, and I had to flush that thing out. I ended up going to urgent care and it cost $80 I did not have at the time. And I paid it back. They let me pay it back, and I'll never forget it. But it's like I knew I had to take care of myself, because if I got hurt or something, it would bankrupt me. And so if I knew that I didn't have to do anything, and this is just human nature, when I say me, that I'm always going to be taken care of and there's always going to be the safety blanket, then I'm not going to take care of myself. And neither are these people that are playing Call of Duty and door dashing milkshakes to themselves all day long. I'd like to sit around and play video games. I like milkshakes too. Don't get me wrong. I'm not knocking that. What I'm saying is that it's not a healthy behavior to do that all the time. And if that's what you want to do, bud, then God bless you. I'm not saying that you can't, but when you have to go to the hospital, I don't want to pay for your crap. And that's just how I feel about it. And that's how I feel about most of the folks. And as somebody I'm certified in wellness, am I slightly overweight? Don't laugh over there, John. I'll slap that, but I'll slap that right at you.
Go ahead, John. Don't.
When it comes to Insurance Extravaganza, since I'm not going to have any stage time, I will be at the pool.
Oh, yeah.
You're going to be showing off my man bod, right? And
you're going to have a lot of time because you're the one that's going to be asking a lot of the questions, aren't you?
At the pool.
Yeah. I'm okay with at the pool, to be honest with you. Just hope Florida is warmer than it's been.
Yeah. So I guess back to my rant. The point is, if there's no incentive for you to be healthy, then they're not going to be healthy. And that's the way I feel about really almost all forms of help or assistance, right? I'm not fully subscribed to the Puritan, you don't work, you don't eat, but pretty damn close.
Yeah. And I agree with that. And that's why when I hear doctors telling me, I'm going to quit because I don't want to do these things, then we have to change that attitude and start to tell patients the truth. If you do nothing with this treatment plan, it won't get better. It's like having bronchitis and not taking the medication for the bronchitis. You're definitely going to get pneumonia and you could end up in the hospital. So what does it cost?
Or dead.
What does it cost the patient to hear it the first time, take the medication for however long it's needed, go back and find out you're doing better or you're not, and there's a different way of treating it? But it is the patient's responsibility. And the problem that I have with dentistry in general is we don't tell the truth to the patient. When the patient needs treatment, whether it's perio, bone grafting, whatever it may be, tell them the truth. Like having oral cancer screening. Who else is going to talk about that? What are the doctors going to worry about oral cancer? But that we can now do the injections for the HPV virus, I'm not saying you have to do it. I'm not saying that the parents have to accept it. I'm just saying that if we, the oral physicians, do not start acting like physicians, we have a major problem, because the medical world is already has a website up. They have instituted in 3 of the hospitals I've put in dental programs, because patients are not supposed to have any form of surgery without a full clearance from the oral doctor. And now we're still not doing it. We're still not even doing the perio that came out in 2017. We're still doing scaling and root planing and
What's the difference between scaling and root planning?
Know why it's not getting paid.
You unpack a lot right there. Number one, you threw down a gauntlet, in my opinion. You said, hey, look, dentists aren't telling the patients everything that they need to know. And they're not doing these things. Maybe they're not doing oral cancer screenings because they're not paid and the patient doesn't want to pay for them. Okay, so the audience can't see
that's a lot of it.
She's nodding her head. And so then you say, hey, listen, patient, you don't do this, then you get cancer, it gets too late. Then you end up like one of those folks that are talking out of the voice boxes. Oh, my name is John Ray, and I smoke Pall Malls every day, like that. Or they could lose part. I remember the guys coming to my school and talking about don't smoke cigarettes because you'll end up like this.
Cancer that has not changed the numbers. Breast cancer is doing better. Colon cancer is doing better. Oral cancer is still.
Is that fair though? It used to kill you. Now it's not. And so, was oral cancer killing people? Is that rate? What's the kill ratio?
It's still a high number.
Okay.
And now with vaping, we have a lot of teenagers getting it. Not only because they're vaping, but they share it. So,
oh, yeah.
We have a lot of problems in our field because of non-dental payments. And so we don't want the patient to say to us, what does it cost? My way of saying to the patient is always going to be, what is your life cost?
That's a good point. There's 2 issues.
It is their life, not our responsibility to get it covered.
It's number one. And I hear you. This makes sense. So there's a number of different serious medical complications that need attention. In order for a medical professional to put their time and resources on it, they need to get paid. But because it's not generally reimbursed on dental insurance policies, they're not doing it. And then when it's explained to the patient, thinks, oh, if it's not covered, then I don't really need it. I see. That makes sense.
And so I think we have to start to be more medical, because that's how we have to think. What we're recommending is life-saving in many ways. Think about a patient that's why I went into medical billing. My people that take a lot of medication, their oral cavity gets destroyed just from the medication. Just from the medication. It's not even from the illness they're dealing with. It's from the medication. So shouldn't we try to nip that in the bud? They need more visits. So finally, dental has put in more visits for certain issues. Not all of them yet, but medical will help pay for a lot of those issues. So it's a combination of knowing, should I bill dental? Should I bill medical? Should I bill both? And I think that's really where I'm coming from. But I also strongly believe that every human being has to take responsibility for what their health is telling them. So that if you are taking medication, going to an oral dentist, an oral physician is going to help you because you can't stop the medication. It's been proven scientifically. What about a person on dialysis waiting for a kidney? If you could wait for that kidney, but if your oral cavity is infected, it's to keep that kidney from taking hold. So we have more responsibilities that we need to let the patient know. They have to understand, not us. We know it. They have to know it.
Gotcha.
If you went to a doctor and you had very high blood pressure and the chances of a heart attack, they're going to tell you.
Wait, would that be like a red face?
Yeah, with your red face. Yes, that would concern me. But you know what I'm saying.
Yes.
It happens every day.
Listen, my doctor is very direct in my PCP. I told him, I said, I don't even like you. I don't like you very much. Because he's always, you can't eat ice cream and, you can't do this and you're too fat and blah, blah. I said, I don't know why I come in here and talk to you. He always made me feel bad. And he's, do you want to die? And I'm like, yeah, all right. So I appreciate the directness. And I was like, so I trust him. I told him, I said, I don't even like you.
They are right for saying that. And I'll tell you the biggest problem, malpractice. Doctors have learned, medical doctors have learned that every time they see you, you may not listen to them, but they're going to repeat it, document it, and make sure that they keep telling you.
But isn't the fat shaming not good for my
they're not
self-image?
Fat shaming you. That's your perception of what they're saying.
I'm just kidding. Yeah.
But if they don't tell you and you don't know, what are the chances are you going to die from something? Pretty high, right?
Pretty high. Yep.
I think everybody deserves the right to know the truth and make the decisions to get help for what they need. An infection in the oral cavity is no longer an infection in the oral cavity. It travels through your whole body. So, and all the illnesses you have also contribute to the oral cavity. So let's keep them together and make sure we stay healthy.
So men, the number one cause of death in males by far, is not even close, is heart disease. And how do you know that you have heart disease, right? It could be genetic, but really high blood pressure. And part of what you're saying is, if you keep going in there and there's, hey, you have high blood pressure, you need to do something about it. And A, it's your responsibility. But B, if you don't do anything about it, then what? Then you're very likely just to have a heart attack.
And what? That's why the heart percentage is high.
It's because men in particular I'll be all right. I'm fine. And it's all sounding killer because you don't feel anything until you feel the pain. And it reminds me of Red Fox and Sanford and Son. And he's, oh, I'm coming to see you.
You know what? We're all going to come and see them sooner or later, right?
I hope Red Fox isn't
actually being a grandmother has made me want to be around even longer. So the more they tell me, the more I do. Because they know more than I do. I may look it up. I may investigate it. And I think every person has the right to do that. Absolutely. I wouldn't do something that I didn't know anything about. If they told me I needed a kidney transplant, I wouldn't let them cut me right then and there. I would want to know, what are the odds? What is this? What is that? But what else is that? What else is it damaging if I do it or don't do it? And that's really how we have to start to communicate. And I think that the people that have it down pat better are oral surgeons and implant surgeons, because they have been named a surgeon. But I know many providers who have taken zillions of extended courses in their career, who maybe didn't take it while they were in college, that are even better than some of them. And I'm not saying they are better. I'm just saying they have a lot of education too. So they need to show that we care about you enough. And it's not about giving a discount. Care is not a discount. Care is, I'm going to try to help you get reimbursed to the best of my ability. And I'm going to maximize your benefits for you. However, you still have to understand that your body is your temple, as they used to say, right? That's your temple. Yeah. And without you taking care of it, it's just going to corrode and fall down.
Right. You only get one, but it's just like your house insurance doesn't pay for everything on your house.
No.
Right. So you have to, Lord
I mean,
knows,
I
as a
feel
homeowner,
right.
I'm fixing a lot of stuff, or I'm hiring people to fix it usually because
Listen, I lived
not
in a
handy.
suburban area in New York. Floods were never an issue. Guess what? Our house was destroyed by a flood, a complete flood. That it
Did
was
locusts come before?
what?
Did locusts come before the
No,
flood?
locust didn't come before, but boy, mold did. Okay, it cost something like 170,000. FEMA comes. It was during COVID. They didn't even come in to look at the house, and they offered us $3,000, and we laughed because we couldn't even live in the house. Never mind get $3,000. What was that going to do for us?
A bunch of
So I
fans.
feel horrible for the people that have had all this happen to them in the last few years, because when you do depend on your house insurance and the insurances are going up because they have more claims, there should be rules about some of these things on insurance. How do they just get to drop
Well,
it?
there's lots of rules. Every state has their own Department of Insurance, and Lord knows New York has a
Lord
very active one.
knows that sometimes insurance was not the best thing to ever happen, right? Giving a chicken to the doctor might have worked better. I hate to say that, but that's the truth. And people think that dying doesn't come from the oral cavity, but that's so false.
And just to be clear, what she means by giving a chicken to the doctor is a bartering system.
Yeah, bartering.
Where at one time, everybody in town, if you were a farmer, you would give some chickens to the farmer, or like in John Ray's case, the moonshine to the farmer.
Yeah.
If you were the butcher, it would be different. If you were the baker, maybe you traded some bread, something like that.
That's right.
And so that's the bartering system was the trade system, made up the trade system for, probably still makes up the trade system in most parts of the world.
It's really the biggest reason why I put the Insurance Extravaganza on when I first did it, was because maybe if people heard it from multiple providers, multiple people in our industry, that there are ways to help yourself. There are ways that every office can benefit from insurance, but there's also a responsibility for us to let the patient know that there is no such thing as full coverage. And that if we see something, we are obligated and can get sued big time. And the reason why I'm talking about it is right now, even hygienists are being sued because they're not telling patients about the infection. They're doing scalings. They're writing down a prophy, but the patient never consented to the scaling. So just recently, a hygienist was sued for doing more invasive treatment than she approved because the hygienist was trying to help the patient.
So I'm going to rephrase that in my own terms. It's still going to be technical, but frequently what happens is people go to the dentist and maybe they haven't been flossing, or maybe they haven't seen the dentist since the Bush administration, and they have perio issues and they only want what's covered, and they know that the routine cleaning is covered. So they're like, can't you just do a cleaning? Can't you just do a cleaning? And what happened in this case is that the lady said, I'll do a cleaning, but she's still trying to help her out. So she's still doing some scaling and root planning, which is more deeper cleaning for those that listen to the show. Although I can't imagine there's too many people that listen to the show that don't know what that means. But anyway, and so then the lady sued because she was getting a better service. I don't get it.
Yeah.
So she sued.
What happened, and this is a true story. It's a true story.
Where'd this happen? New York?
She was bleeding in her oral cavity, and she went to the emergency room, and they said, you didn't get a prophy, you got a scale. Did they use a harder instrument? Yes. But nobody asked her medical history either, which showed that she was on Coumadin. So now she's got a lawsuit like nobody's business.
Gotcha. Coumadin
You
is blood
can't
thinner
try
for
to
those
help
of you
somebody without
non-clinical.
their permission. Number one. And number two,
That's
you
why
better
I don't
have
help
an
anybody.
updated medical history every time you see a new patient, not once every 3 years. I don't know about you, but
That,
I'd love your opinion on this, Patrick. Do you remember what somebody told you 3 months ago?
no.
I don't. I don't even remember what somebody told me yesterday.
Well, you're a grandma, let's be fair.
Yeah, I know, but still,
You know,
it's not easy
my
to
grandma,
remember
my
every
grandma
single
used to
thing.
say, in fact, I think my mom says it too now. She says, I suffer from CNS, can't remember, or CRS, can't remember.
I may
And
have to take her little thing. Yes. Could I borrow that, Patrick's
yeah,
grandma?
you can appropriate. Yeah. Yeah. Her name's Sarah.
But
She's
isn't that
cool
the
with it.
truth? It's like,
Yeah.
so I get the call. I don't know about you, but I get calls. I'm not getting covered for scaling and root planing. Okay. Was the patient in last? Did they keep their perio maintenance exams? I want to do a perio maintenance, but there's so much calculus, I can't. Then you have to bill scaling and root planing and not a perio maintenance.
Right. And I think most patients actually know this. This is just me. This is just my opinion. I feel like we're all just big kids trying to see what we can get away with sometimes. Right. So if you're not going to say anything to them, and I'm also trained in high level negotiation, by the way, which is also low level negotiation because all negotiation is.
But see, I'd rather them come to you as an office and say, you know what, Patrick, we have to get some raises in our fees because we can't even afford to pay a hygienist at this point
I hear
to
that all
do
the
the
time.
treatment, which, by the way, when I went to California and those hygienists are getting $90 an hour and they're doing pro fees, who could afford them if they're on insurances?
Well, you got some in Georgia getting paid $90 an hour. And
People have
you're
to
absolutely right.
So who doesn't understand that? Is it
The hygienist?
the hygienists don't
No,
understand?
who doesn't understand that the hygienists are getting paid that much? The patients don't understand that.
There's such a shortage across the country that we're dealing with.
We lost a team member that was an RDH because I can make just as much or the same and make my own schedule. And I can't. Hey, that's not sound great. Maybe I should be one.
Maybe you
I'll be
should.
like, I tell them, I say, you have yuck mouth sores all over the place. John Ray knows I'm not shy. Yeah, I'm not getting sued. You're not suing me. My table. I don't know if my chairside manner would be great. I probably wouldn't get that.
No, you would not be a
Five-star
good
reviews.
chairside manner.
He'd be like, he's rude.
Forget it.
He's not nice. But I wouldn't get sued. So I'd have that going.
Now, Patrick, tell me what you're going to do at the insurance meeting. You're going to interview everybody and see if they learn.
So that's a great question, Christine. So I am super excited to be at the Insurance Extravaganza this year. I have not been able to go in the past few years because I've been coaching basketball with my son. And so this is the first year. He's a freshman in high school, and so they don't need my help over there. And so I'm going to come down, and I'm coming down with Emily Jenks, who's on my team, and she is very excited to go. She knows who you are and who a lot of the speakers are, Teresa Duncan, Colleen Huff, and understands that this is an exchange of intellectual capital amongst very established thought leaders in our industry. And so she is going to be doing the visual. We don't usually do this. This is Dental Business Radio. And so we don't usually have a visual portion, but I will be down there. I will have portable microphones and I will be talking to attendees, sponsors, speakers, and anybody else who seems interesting to me while I'm there. And then we're going to make a show out of it. And John Ray is going to, look how happy he looks. He's going to get to
really happy right now.
Edit all of that stuff out. I'm just going to keep her microphone with me everywhere I go. So that's what we're going to be doing. You tell me as an attendee, or let's say that I haven't been since, I don't know, was it Vegas? At any rate, what are you excited about this year? Why should folks who have attended in the past, but maybe not last year, what's new this year that they should get excited about? Besides Dental Business Radio being on location.
I'm excited about the speakers that we have that have so much knowledge about insurance, writing documents, note taking, so that we can get paid the first time we bill something. I'm excited about a new medical speaker I have coming, which there's not that many of us. So I'm excited to have another colleague that teaches what I do. I'm
Who's that?
excited about the numbers, and I'm sure that you're going to be able to help people just talking to them, because the numbers are the most important thing for every doctor that's attending. And then the new laws that have changed, like ICD-10 being on dental claim forms. How do you even fill out the dental claim form? What warehouses are ready for the updated claim form? There's a lot of.
Can we get Elon Musk to come down? And
I would love Elon Musk to come down.
Elon, listen, man, you really got to get on this. We need Doge on some of these regulations. There's no need to fill out all these forms, because that's another reason why people aren't going to do it, or docs aren't going to do it. I'm not a big fan of paperwork. Why do we need to do all this paperwork? If they know what they're doing, they just need to tell the people and get them to sign off on it. They don't need to do an entirely new coding system with all of their practice management stuff. How much money is this going to cost? That's what's silly. Bureaucratic rules.
Yes, it is a lot of bureaucratic rules.
And so that'll be the theme of my show.
And I'm gonna ask you to focus in on why people are, and to me, this is the most curious. Why do people even think that a front desk in any office in this lifetime of ours, it's not like 1960, where whoever was up front could answer the phone, check people in, fill out their form, because there was maybe 10 people that day that had even dental insurance, and do all of that, and then become somebody who could help you talk to patients. Those days are over. You don't see any medical office doing that. Everything is sent out to somebody who can make sure it's done, who can look up the codes and scrub that claim. Insurance companies are scrubbing the claim after they're paid. So why aren't we doing that in advance of sending it in, wasting 30 days, and then having to get it denied? Or a question from the insurance. This is under the medical. Please bill medical first. And nobody knows how. And I get panic phone calls on, I don't know how to fill out. How do I fill out the dental claim form for surgical wisdom teeth extraction? I would love to help everybody that calls me, but it's almost impossible for me to just give you the answers to that, because there's more involved in
every situation is different.
And just doing the codes. The codes are minor. It's the why. Why does the patient need this treatment? Why does this patient have a medical history? The ADA put out an updated medical history by request of the medical community.
Interesting.
Why? Because they can't refer patients to us if we don't know why they're referring them.
That's a really good point.
Okay. So we have to change the way we practice, not just the doctor going for an updated course in, I'm going to do bone grafts and implants and overdentures, and the team has no idea how to bill for it. And they've got no training. Nowadays, everything is a team sport. If you don't have the right team, the sport's not, you're not going to be the winner.
I couldn't agree with you more.
And that is really what I see. I see doctors going for their courses without teams. But I could tell you the one company, the one big group, the implant organization, they have a whole track for the assistants and the billers. So
now, I'll
give a specialties
shout out to
doing
Amos.
that?
Amos puts together a practice management and a billing.
And I'm part of Amos. I'm teaching for them this year at their meeting, not just on.
Are you?
Yes.
Oh, I'll be there. I'm not speaking this year.
Good. So we can both teach.
All right. I'll come into your class and learn.
But that is the difference between a doctor that's in a specialty. But that doesn't mean they learn everything. They just learn that one specialty.
We can't
So-
get too much knowledge here. I like to think that I'm pretty good at what I do, right? But as I tell my team, I go, we should be learning something new every single day.
Every
If
day.
I don't learn something new today, I failed at one of my goals. I want to learn something new. I've learned 2 things new, at least on this particular show. And hopefully all of our listeners have learned something as well. That's if you're not learning, you're dying, in my
Right.
opinion.
And one of the things that I always talk about to my clients about you is years ago, when I was still working in an office, used to get a letter from the dental insurance. If you're going to stay in network, do nothing. They're still using that letter. That is so untrue because every year they change something and you don't know about it until after the fact. So you should be asking for a new contract. What's changing? They need to call you for new contracts.
This is a whole show in itself. I think that you just brought up something that my antenna is very high up on, and it's on my radar blinking, because I think that the recreds might be used as a bit of a Trojan horse. I don't know yet, still monitoring it, but that is an incredibly valid point. The other side, to be fair, will say they should keep their contracts, right? And we would always, if they were going to make any changes, that they would communicate that via in writing by USPS or what other means have been agreed to. That's what the other side will say, or the insurance companies. I still say we sometimes, because I identify somebody from the insurance world, even though not all of you want to embrace me. I don't want to embrace all of my family either.
Okay, but I feel like as each one of us, that's why I do this meeting, Patrick.
Yeah.
There's so many changes that if we don't have people to go to each other,
yeah, there's
like
too
other
many.
speakers,
There's no way to
other
keep up with it.
experts and things, it's impossible for any one of us to help an office the way they used to hire a consultant. Those days are over, in my humble opinion. Because
Right.
even a regular consultant, they call me, they call you, because why? We specialize in something.
Right.
So the need for us is as high as it ever was, really.
I'm never bored, that's for sure.
And that is really a major component. And I wrote an article, attention doctors, do not sign unless you read the contract, whether it's your first contract or your second contract or your third contract. And you shouldn't just say yes, because then I get the calls. Teresa gets the calls. Colleen gets the call. You get the call. We all get the calls. I don't understand leasing. How did leasing come to now?
Or they get all very upset and they're like, they can't do that. It's
They
illegal."
can't do this to me. Why? How could they do this? Well, you didn't read
you
the
agreed to
contract.
it. You signed right there. That's right.
I tell people all the time, if you bought a home, you would not buy it without reading a contract, and you would have a lawyer because you need somebody with expert opinion.
Right. Or at
I
the
am
very
not
least,
that
you would have an
person.
agent. You would have a real estate agent, right? So you have
No.
somebody who's used to, or a lawyer. You need somebody that's used to the minutia that can go through all of that.
And that's
right?
why people ask me, why do you collaborate? Why did you give away? Like, why do you care if all these other people get clients from the meeting I'm putting on? And I'm like, are you kidding me? There's enough clients to triple the speakers. That's how I look at it. And
Sure.
I don't own every rule. I don't know every rule. I don't know everything. That's why I surround myself with good people.
Right. No, and
Only
I am
way
honored that I could participate and be one of
And,
those
I
people, because
mean-
I agree with you. I get a lot out of that. And there's not too many places where you can go where you're getting so many perspectives from not just, hey, a little bit of experience. You're talking about decades of experience.
I hate to
Decades.
say it.
Yes. Yes, me too.
I hate to say that.
But all of us, and even when we're sitting at a table, it's not like all of us always agree either on any given issue. quite a bit of spirited discussion, I think, and interpretation of what is happening and what impact that's going to have on healthcare, our clients, the dental provider community as a whole. And that's really, when I'm there, I feel like I'm at home, right? It's very rare that I can go somewhere and everybody knows what I'm talking about.
Well,
Usually,
because we want to take your courses, not because I want you to teach me, but not because I want to do it. See, this is what I get from all the speakers. We need to know who is the expert in this that we could rely on for our clients. So when I wrote this article, Attention Doctors, it wasn't for me to get work.
where did you get this published? Where did the article get published? Or you just
I put it in my newsletter. I put it in my newsletter, but I have your name on it. Why? Because I can't do it, nor do I want to do it. How do you like that?
Hey, listen, sometimes I question my own
That's
sanity.
why my relationship with other speakers, whether it's Teresa, Colleen, and I just had a great debate. And it was a debate. And I said to her, listen, Colleen, I might have been a mentor to you, but you are way past me at this point. You wrote a book. You're doing this. You're doing that.
She's like a
You have
now.
to teach what you believe. My feeling about the ICD-10 codes is I'm not going to wait for an office to say to me, but you did not say it's this too. I'm not going to do that. I'm going to say, let's just tell them what we know. Because when the government writes rules, there's no, you have to do this or that on this or that. This is what I got. Dental claims now require the use of ICD-10. Several states, and the states are 48. So,
oh, good Lord.
48 states, okay, are listed. And so, am I supposed to know every time I go somewhere? I go everywhere in the country, whether it's not, I give them the states. If your state's here, I would play it safe and use the ICD-10.
All right.
Because
my worry again on this, just for the record, is that CMS is trying to tie everybody to the Medicare reimbursement rate, which has not worked out well financially for most other disciplines. I think that there's a lot of push in that. And I hate to see the ulterior motive, but I've been around.
For me, the sad thing is we have paid for it. Or every day you worked, you paid for it. Medicare.
For Medicare?
Yeah, Medicare.
I know.
Medicare. But Medicaid.
I am professionally certified in Medicare, actually, Christine.
Okay. Medicaid is given to people who can't afford.
Medicaid's for low income disability. Medicare is for when you are past your working age. We all pay into it with payroll taxes. Medicare is administered federally.
Same thing with Social Security. That's not their money. We paid for that.
That's right.
In my humble opinion, we have the right to say a lot of things.
I agree.
And I'm glad somebody's finally looking at it because I don't think anybody should spend my money. I want to spend it.
That's right. I want to spend your money too.
Yeah, you're not spending mine. You could spend your own. Okay. But you know what I'm saying.
I do.
So that's really the gist of this whole meeting, because everybody deserves to hear multiple people. Not everybody's going to like me. I know that's hard to believe.
I find that very hard to believe.
But not everybody's going to like me because there are certain parts of the country that I come off really tough. But really, I'm a crier. I just want you to know. Yeah,
you know what? I think that a lot of the New Yorkers, New Jersey, like that stuff's all overblown.
We just are brought up that way.
Kind of cupcakes, really.
But yet, it's really, we do come off tough. That's how we're raised. In my generation, you were on the street. You've learned how to protect yourself. You learned how to play fair, because if you didn't, then you got beat up. It was just the way it was.
Christine the only thing we did, Christine was the one she was giving out the beatings.
Yeah, I caught a couple myself, but the only thing we did for free was go to the top of the building to watch the Yankees. That was my cheating.
How
Okay.
about that?
Every state brings a different flavor to me because
I
every
agree.
state is so different that I go and I learn as much from them as they do from me. Honestly.
Oh yeah, I totally agree. I was just in California. Now I'm in Texas.
And I think it's because of the travel and the people that live in certain areas are much different than how I grew up. And it's given me a very big perspective on people in general and why they think certain ways and why they do certain things. And I am not timid, but yet I'll meet people in certain states that are very timid. And
yeah. Sometimes it's part of when I first got to the South, it's a humble.
Yeah, but the South people kill you behind your back.
No, that's the Midwest
straight
people.
For the juggler.
Yeah, that's what I think. That's what I heard. It's right. The Southern folks are Southern. They'll tell you to pee off. They just say bless your heart.
Before we finish, I have one other question for you.
For me,
unnecessary write-offs. What do you have to say about the unnecessary write-offs that offices are doing?
Give me an example.
I give you an example. I personally, when I first started, worked in a wonderful office. I'm still good friends with them. And then I was teaching at NYU, dental school, the university, and I had
I never heard of NYU.
I know. But I had both of their sons then in my classes at NYU Dental. So I consulted for the parents, mother and father. And then I was working at NYU and I taught the kids. And one day I said to the mom, and I won't use names, but I said to her, you know what? With the amount of gifts you give out, unnecessary write-offs is what I used to call them. You could have bought me a Louis Vuitton 5 times. I would like one. I can't afford one. So I'm going to track for you how much you give away this month in unnecessary write-offs. And then you're going to take me to Saks Fifth Avenue and you're going to buy me that Louis Vuitton. She goes, no way. That's never going to happen. I don't give away that much. Guess what? That month, I took her to Saks Fifth Avenue, Patrick. Now, I didn't get the bag, but boy, I made her nervous when I said, let's go on a shopping spree. Come on, you owe me. And we did go. And I looked and I picked up and I was smelling them and I was, oh, this is the nice. No, I want that one. It was even more money. And I said to her, do you really think I'm going to make you buy me one? This was a lesson that there was the only way for you to hear what I was saying was to actually see that's how much that bag is, how much you gave away this month.
I've been giving too much money away in my marriage. I'll tell you that. I see the LV. I see the LV. I probably don't know how much it costs.
They cost a lot.
Oh, thanks for that.
Okay, so LV, the doctor, my doctor friend.
Yep.
From that day on, she learned to curb her enthusiasm of a case.
I see.
Understand what I'm saying?
Yeah. So you're saying that
I said you have 2 sons in university that are going to come work in this office. If all of you do what you do, you might as well close it now.
So if you're saying, are you talking about writing off co-insurance? Or are you talking about
I'm talking about writing off things that are a balance that they didn't collect a co-payment or
never write
away.
You never write off co-insurance or never write off co-payments at all.
And nobody knows, nobody has control over it. So it's done. The doctor doesn't even know. And they see a day sheet and they see write-offs, but they think it's because they have to write off. So one of the things I've tried to teach my offices, when you write off because you're in network, write off towards the insurance, not just write off because
the doctor you categorize it.
What are you writing off for?
It's a network participation discount, not just a write-off. You could write off because they're your neighbor, it's your mother-in-law, right? There's a family write-off, let's call it. And then there's a network participation discount. And so that means you usually
Well, you
charge
have to know
100.
what you're writing off and why.
Oh, yeah, absolutely.
And
So
who
that's
gave you permission to write it off?
if it's a network participation discount, it's contractual.
The insurance company, you have to, but then write it off towards that company.
I agree. I totally agree. And
so that the doctor knows. How do you decide whether you're going to be in network or not?
it comes down to 3 factors. Number 1, empty chair time. If you have empty chair time, something to consider. Number 2, there's a marketing component to it. It's not free, right? It's not free marketing. It's outsourced marketing.
Mhm.
And then the third reason is for referrals.
Okay, so there comes my point. I had a doctor who was making a lot of money on an in-network plan, but wanted to pull it because the hygiene fee was so low. But when I looked at his money, he was selling a lot of other dentistry that wasn't covered to these people.
Right.
So I look at that too. And then
Yes.
I look at if bone grafts are not covered under dental and the patient has to pay for it, they're going to ask for a discount. But if you charge them the full fee, bill medical for them, let them get reimbursed from the medical for whatever it's covered for, because it is covered if you do it correctly,
Mm-hmm.
just like any other treatment you're going to provide. Like sleep apnea, there's many doctors not in network. You don't have to be in network. You don't even have to be in network with Medicare anymore to bill for it.
Oh, I'm a big believer in sleep apnea. I don't know if you know. I
Okay,
had the
so why
surgery.
are you
I got-
jumping in?
I got the mask over there, the CPAP. I take it everywhere with me now. And so I
You
have the
need an
energy to keep up
appliance.
with you. So that's a really, these are all very good points.
And that's basically what you get at this meeting. Not from me only, but from all the others. Everybody that's there has a lot of this knowledge.
Right. Not
And-
even for me. I'm just walking around with a
Well,
microphone.
you're
and
going to be
Emily-
asking what did
Emily
they
is-
learn, and you're going to teach them. I know you are. It's something in us that we can't let go of.
That's true. And I'll have Sophia Coppola. Coppola?
You're going to
Emily
have
Jane, Sophia.
conversations you're not going to answer. Come on, Patrick. John knows I'm right. You're going to look with speakers. What does a speaker do?
Hold court.
Okay, there you go.
I'm excited.
All right, I'm excited.
John
too.
Ray would be down there.
Take John. Yeah, John, you love us.
He's exciting. He's excited.
All right.
All right. Listen,
All right,
thank
love
you for
you
being on the
guys.
show. Now, where do they find dentalmedicalbilling.com?
Yeah.
See Insurance Extravaganza, and it's in Orlando, Florida, so it won't be cold.
No,
March
March
14th,
14th and 15th.
15th at the Sheraton Orlando Lakes
And this
Buena
is the-
Vista.
There's a discount on there. So if you don't join now and you don't buy your tickets now, there's not going to be a discount. Because
Hey, you might have to stay at the Motel 6.
I think that you guys, whoever is listening to this, it's not about how much you pay for a course. It's how much you bring home. If you
Amen.
have team
What's
members
the
and you
ROI?
that are coming and you can't find 10 good points to bring home, I would pay you back.
There you have it there. All right. So for our listeners, dentalmedicalbilling.com, I'd like to thank Christine Taxin, DJ John Ray, and our sponsor, Practice Quotient, PPO analysis, negotiation, and strategic guidance. And that's for top tier dental providers and dental specialists. If you need help with your strategy, your contracts, understanding what's in your contracts, are they working for you? Are you working for them? Call the fine professionals at Practice Quotient at 470-592-1680. That's 470-592-1680. Or visit www.practicequotient.com. And until next time.
Thanks, everybody. Bye, John. Bye, Patrick.